I have a story, I have a testimony. So faith played a big part of it.
Having this dream of being a mom, fulfilled, I would say that's the biggest thing for me.
I tried herbs. I tried, being on a stick every morning, an ovulation stick, just to see, like, if I was ovulating, oh, it's time.
I've had a miscarriage where there were no symptoms until I went in for a normal, scan, and we saw on the sonogram there was no heartbeat. I've had an ectopic pregnancy where the baby actually began to implant in my tube rather than in my uterus. That was the last pregnancy that I had, and that actually ended in a emergency surgery because it put my life at risk.
The human side of me is just like, damn, I wonder what that would be like if I can just do this normally.
Lots of times it's like minority women, that there were a few people that were going through what we were going through. So the fact that this concept was really based about the fact of our community and sharing our story and getting our stories out, it was just truly meant to be.
Beyond the loss of a child is a loss of hopes and dreams, and there's always constant reminders, especially being pregnant with other women around the same time, and their daughters and sons are celebrating their birthdays and they're having holidays, and you remember, oh, we were going to have a baby around the same time.
I believe I just convinced myself that what I was going through was too large, it was too big, too painful, and not everyone would understand.
I was 20 weeks pregnant, and I lost my first son, baby boy. It was something that was very painful for me to go through. I don't wish anyone to have to go through this experience.
After trying for months, and then months turned into a year, and a year turned into 2 years. One doctor saying, oh no, scar tissue's not an issue. And another doctor saying the same thing, but yet a specialist telling me something else. I knew that I had to continue I owed it to myself and to our family, because this desire was so strong in us.
I started to feel really sick. I started vomiting, and at some point in time, I passed out. Ambulance picks me up. We get to the hospital. It's really frantic because I'm in pain. And then when I woke up, I wasn't pregnant anymore. And that's when someone came in and told me, I lost a baby. They had to perform an emergency cesarean hysterectomy.
And when we went to the doctor, they were doing a sonogram, and they were instantly able to tell that I was going into labor. My cervix had already opened, I was dilated, and my son was coming. And so back and forth of trying to get back into work, going back and forth into the hospital, just trying to be there for him, be there with him, making lots of medical decisions, him going through multiple surgeries. He fought a good fight, and we did this with him for 4 months. He was here on this earth, and before he passed away.
It was important for me to focus on being in that moment. So just being in that very moment. So not thinking about the past, but also not allowing myself to get too far ahead in the future. In addition to just kind of exercising my faith and leaning on scriptures and prayer and communicating with my husband, I spent a lot of time just kind of being mindful, doing meditation, breathing, bringing myself back to the present moment.
The funny thing about life is, like, you kind of think everything's going to happen a certain way. So when I got married, I thought, like, okay, we're going to have a baby. And I was so excited. The first couple months, the first couple tries, I even went and started building a nursery and doing all those things. And now, a year and a half later, we still haven't been able to conceive.
So I had a lot of different fertility challenges. I had fibroids. My husband and I obviously wanted to have children. My husband has 2 kids, and we wanted one of our own. So I had the laparoscopic procedure to remove my fibroids, and I gave myself the proper time to heal. as I was instructed. So a year and some change later, we were pregnant. I ended up having an issue during my pregnancy. I actually had placenta previa and placenta accreta at the same time. So it caused me to really go into preterm. My son was stillborn at 5 months, and I ended up almost losing my life, actually. I had to get a blood transfusion. My son came on his own terms. They were trying to actually wait to have him removed the following morning via surgery, but he came before then into the restroom and he came out of me, and I just started really bleeding profusely from there. So the team of doctors came together and they were able to save me, and in order for that to happen, they had to remove my uterus. So I had a partial hysterectomy. So I still have my ovaries, but my uterus had to be removed in order to save my life.
When you go through something like this and it's still recent and you have people that genuinely love you and want to support, but sometimes they make inadequate or the wrong types of comments. And then I was very sensitive. And so I talked to my husband about the kind of things that, kind of were triggering at that point that I guess just made things worse. And so he was the one that usually had conversations with people about, if you're going to come see her to try to cheer her up or make her feel better, just make sure that maybe ask too many questions about what happened right now because she's still sensitive.
Everything that I see for myself or for my family is not always what God wants for me or for us. So continuing to just be patient, learning to continue to just walk by faith and not by sight, and to always remember that, things are going to work out for my good.
It just made me more interested in being around families and being around kids and babies. I mean, it was a time that, I couldn't do it. Anybody who got pregnant after me, it was a little bit tough to deal with or to hear, but I pushed through because I knew that this is a miracle, things that happen for a reason.
And especially because I've held him, he's been here, I've fed him. So I had to pray really hard, and my faith was tested because I asked why a lot. I was angry a lot. And so I had to really try to tell myself that this was bigger than me and that there's a reason why. I still haven't figured it out, but I know because I do believe and I have faith, right? So I just hold on to that for a sense of peace for myself.
My best friend's son reached up and he put his arms around my neck, and literally in that moment, because I had kind of given up hope, because I didn't know what it felt like to get pregnant or to have a child. In that moment, I had such an intense feeling of love that I thought, okay, this is something that I still want to keep trying. This is something I still want to keep pursuing. So honestly, being around the kids is what kind of reminds me of what my end goal is.
What's been most helpful for me is other women who have been in my shoes, because it's something that unless you've been through it or experienced it, sometimes there are no words. Seeking professional help and therapy. A lot of doctors' offices, they offer those services after you've had a loss as well. So I would say don't be afraid to ask about those things because those services are out there. And then also if you have a faith, relationship, to just dig into that. I spent a lot of time journaling, and I continue to do so, journaling this pregnancy as well.
We made a deal, when we left the hospital, that we would just allow ourselves to experience any emotion, Any emotion, however it came. And that we would be open and understanding of each other. And that we would allow our son to only bring us closer and never put a wedge between us.
I'm actually a therapist, so I'm a mental health therapist. And so in the future, I'm trying to work with, the population of women that have suffered or have gone through a loss is really something that would be interesting for me, to be able to do something like that, or to just be able to support women that have gone through this.
There's this saying that I have recently saw on a t-shirt where it says a little bit of science and a whole lot of Jesus. I have a strong faith and I never gave up. But I know that God promised us that we would have more than one child. And I'm just elated and through the roof. A little, have a little anxiety sometimes, but He blessed us with another life. And I'm so glad that He gave man the intelligence to be able to come up with some of these different methods that would allow women and couples to be able to experience the same joy that we are getting ready to embark on for the second time.
We're excited. We are super excited. We are going to start the process for adoption. We know that it could possibly take maybe 1 to 2 years. We already have an adoption agency that we picked out, and so we kind of know their process and their timeline and all the fun classes that we have to take to learn how to be a parent, which is going to be really interesting. But those are the things that's going to prepare us for this big journey that we're about to go on.
We moved on to get some assistance through a fertility clinic where we could actually do in vitro fertilization, test the embryo beforehand to make sure that it was viable, and implant. And we actually did have success with that procedure. And so I am currently 21 weeks pregnant with a healthy baby girl.
I feel a sense of peace, knowing that I was able to have a successful pregnancy and have a healthy baby. And so I'm just extremely thankful for that, and I'm in a good place. My husband's in a good place with it.
I know I'm planning to do IUI and I start that next month, but what's actually going to happen next, I have no idea, because I think it changes every single day. Tomorrow you could find out you're pregnant, or you could find out that this is the path you're going and maybe you need to take a different route. What's next for me is honestly just being full of hope.
So, in the spirit of being an active character of my story in my life, my husband and I have decided to proceed with IVF, and we're working on just pretty much creating an embryo, so that maybe we can move into surrogacy, shortly thereafter. We're not giving up, and we're believing that, what is for us is for us. And it may just look very much different than what we thought, so we are taking the steps to actually enable that procedure.
Together, we
Will
overcome, dispel, progress.
Together.